Hi, Dr. Merrill here in Code's Classroom, and today we present strategies for caregivers. What can you do? So the biggest thing that we ask is understanding your loved one's hearing loss. So there's a difference between hearing and a difference between listening. Hearing is detecting and perceiving sounds. Hearing loss can produce physical changes to the brain, neuroplasticity, you lose it or you lose it. Listening is the processing and understanding of sounds. Listening skills deteriorate as a result of this neuroplasticity. So you have some loved ones. They might hear you a little bit, but because their hearing is deteriorated, it's harder for them to listen, to actually process and understand the sound. So they're not ignoring you, they just really can't hear you and understand you. So encouragement. So if you're noticing that your loved ones aren't hearing as well, they seem like they're not listening, they're not processing the information, encourage them to come in for an appointment to listen to the option to pursue hearing aids. So communication strategies. Once you realize that your loved one has some hearing loss, there's a lot of things that we can do as caregivers to help those loved ones with hearing loss. Attention. So grab their attention before you talk to them. Minimize as much background noise. Visual cues are very important, so make sure you're facing them. Rephrase, do not have to repeat. If they say, I don't know what you're saying, try to rephrase it in a different way instead of just repeating it louder and louder. Also speak clearly because that helps with the processing of sound. So clear speech is when the speaker attempts to express every word and sentence in a precise, accurate, and fully formed manner. So you're not raising your voice, you're not having it be exaggerated, but you're trying to be a little bit slower, a little bit louder, but lively. Better use of tones, stress on keywords. Also, pauses between sentences also will help. Again, repeating it at a louder level over and over again does not help. Examples of clear speech, the ship left on a 2-week cruise. Normal conversation, the ship left on a 2-week cruise. Clear speech, the ship left on a 2-week cruise. So it helps the patient understand a little bit better. Another thing you can do as caregivers is learn how to hearing aid troubleshoot. You can learn how to clean and troubleshoot the devices by changing wax filters, cleaning the mics and domes. We have so many videos on our YouTube channel on how to do that. We also have you come to the appointment to be able to go over all of that with us when they get their hearing aids. Come to appointments. Like I just mentioned, we really encourage you to come bring your loved ones to the appointment so that they may better understand the process of hearing loss and the amplification. We go over what the hearing aids do for you and also how to clean and troubleshoot them. Emotions are really important. So your loved one values your opinion. So we want to make sure as caregivers to realize that they do this and that they want your support. So be emotionally supportive. Hearing loss is, can be very hard for a patient, and to be able to have your support is really helpful. Be patient. It takes time for someone with hearing loss to understand what you're saying. And knowing, having your loved one realize that they have hearing loss, that they need help, can be an emotional journey, and be respectful as well. So if you have any questions, call us today. We are here, and like we mentioned, we encourage all of the caregivers to come in to appointments with their loved ones. Until next time.